Today we are going over the Ebola virus. This is a disclaimer. This video is strictly for entertainment and educational purposes. I am not a medical professional. Ebola is a deadly disease that occasionally has outbreaks in Africa. I know that it has also reached the United States once before. It's mostly affects humans and primates. It was discovered in 1976 near the Ebola River, which is located in the Democratic Republic of Congo in Africa. The true origins of this disease are unknown, but it is believed to have spread from animals first. The virus is spread through direct contact with infected tissue or bodily fluids of the infected host. So transmission. The virus can spread through contact with infected tissue. Bodily fluids of the infected host can transmit the virus. In people, Ebola virus disease can be transferred only after the signs and symptoms have begun to show. Ebola is not known to be transferred through food. There is no evidence of mosquitoes transmitting Ebola. The virus can remain active on surfaces for hours and up to a few days in fluids. Proper cleaning is necessary if exposure happens. Some signs and symptoms. So symptoms can manifest between 2 and 21 days after infection. It typically starts with fever, body aches, and fatigue, and then progresses into other symptoms like diarrhea and vomiting. Most secondary symptoms progress into gastrointestinal hemorrhaging and bleeding. So it's usually internal bleeding and stuff like that. It is an uncommon disease, but once contracted, it is deadly. Antibodies can be found in the victim for up to 10 years after they've recovered. Diagnosis. So it can be difficult to diagnose because it shares many common initial symptoms with other sicknesses. So fever and fatigue are usually common symptoms with any kind of infection. So it's difficult to diagnose until you can confirm that that the person that is infected has, come in contact with something else that has a known infection within the last 21 days. If an exposure is noted, the victim should be isolated from other people. Blood tests can confirm Ebola before secondary symptoms begin. But it could take up to 3 days before Ebola can be detected in the blood. So treatment, there's 2 known medications that are used to treat Ebola virus disease. Imazib is a medication that prevents and blocks the virus from attaching to cells. And then the other one is Ebola, is a trial drug that does the same sort of thing where it blocks the virus from attaching to cell receptors. So antibody treatment is the primary way of dealing with Ebola. Thank you for watching.